All right, so this is another topic, right? So with any technology in general, I'm not going to knock social media, internet, this, that, or the other. But let me tell you something. There's not a regulated industry that tries to fact check what is real and what's not. So let me say I go on Instagram and I hear X, Y, and Z, right? Do I know it's actually evidence-based? Because even then, as a doctor, we're constantly learning new things. Like this medicine worked and now it's not as good as before. So how do you expect Joe Schmo on a podcast or social media who wants lots of followers to then promote, oh, well, you take this thing and it'll make you feel really better. One book that I highly recommend if you want to learn from actual psychiatrists about nutritional supplements is called How Yoga, Meditation, how how yoga and meditation can affect mental health. It's actually a great book about supplementing medications and other lifestyles. It's by Dr. Philip Muskin. Now, do I think social media is good? It depends, right? Like anything. Could you go on the internet and read a bunch of symptoms and diagnose on Google? Yeah, but is that the truth? No, because there's actual on Google, they have an algorithm for any person that's ever said anything, right? But that doesn't mean they didn't have it before the medicine. And so the best way to identify it is through actual scientific studies that do double blind trials to say this medicine worked or this one had this side effect. Let me explain also how I know. I read many books on the molecular level of medicines. Sometimes people won't describe, they'll describe a symptom that does not actually exist in the medicine itself. Now, am I saying it's not possible? Yeah, but that's also like I can give you a sugar pill and you'll feel so much better. Why? Because the mind is very powerful. What it believes, it wants to believe. How is it that some of my patients will read a checklist of all the symptoms and develop this exact same symptoms? It's usually called illness anxiety. So I think social media can be beneficial. I think just like anything, the filtering system is completely off, and a lot of it comes down to deregulation of social media in general, the internet. Nobody polices anything. Even nutritional supplements, it's a non-regulated field. So with my patients, I often recommend, well, I will tell you what's good based on the books that I've read. Because if you buy something from Costco, it's not going to be good quality and you won't like the effect. So why waste your money? Why not find a good source? And so I do think that social media can help promote mental illness, but I think you should also be a consumer that looks for the good and bad and don't believe everything that you read. In fact, you should cross-reference myself, even though I'm a doctor, because that's probably in your best interest.